some people that they are prone, they are susceptible to the disease, and they are going to enter to your community. So the prevalence rate of your community for the disease, for that disease, will increase. Improve diagnostic facilities. Who can guess what's the meaning of improved diagnostic facilities and the relationship between this item and prevalence rate? Who can guess? Any volunteer? No problem, try it. Try it, you can get a point. If you say correctly, you can get a point. And if you don't say correctly, you don't have any zero or any negative points. No. Who can guess? Improve diagnostic facilities. For example, imagine that in our recent modern era, yes, we are improving our diagnostic facilities. So we are able to diagnose people more easily, and we can diagnose our patients better. So for example, compared to a decade ago, compared about 40 years ago, we didn't have any CT scanning, we didn't have any sonography, we didn't have any MRI. So there were a lot of people with diseases. There were a lot of patients, but we were not able to diagnose them. Yes. So in this year that we are able to diagnose them better, we can report them better. So our existing cases will increase, not because the difference in the number of the people, because we are able to diagnose them. But in comparison with previous years, in comparison with some decades ago, we were not able to diagnose them. So our prevalence rate will increase. For example, these days we are able to diagnose breast cancers easily compared to 4 decades ago. So some cases who are able to be diagnosed in these days, we were not able to diagnose them 4 decades ago. Yes. So nowadays the prevalence rate will increase. Of course the number is different, but the prevalence rate will increase because we are able to diagnose them better. Another statistic, mortality rate. Here we have frequency of death in a population during a specified period of time. So we say crude mortality rate. The mortality rate from all causes of death for a population. Again, we have another formula here. For crude mortality rate, we have a numerator and we have a denominator. What's numerator? Deaths during calendar year. And what's denominator? Population at mid-year. Yes. Again, we can multiply it in 10n. Yes. Exponent, and we can select any exponent for it. Another test. Yes, great, a question. Thank you very much.
Why do you use the population of the people during mid-year and not the population of the people during the
Yes, thank you very much. Because there is a difference. For example, imagine we are speaking about a calendar year. For example, we are speaking about 2018. Yes, last year, 28. And you know, in some countries like Iran, Iraq, Nigeria, the population increases. Yes. So the number of population, the number of our population, they are different at the beginning of the year and at the end of the year. So for calculating the formula, we need a number. Which of them is better? The beginning or at the end? So in this way, we can choose. We select the mid-year, the middle of the year, because it's the more representative and better representative for all calendar year. Thank you very much. So here, example, in 1998, there were 21,000 deaths in a mid-year population of 3,750,000. Calculate crude mortality. And no problem. Whatever you want, no problem. It's optional. Calculate, guess it. For example, 100,000.
Yeah, it's
56.
56.
50. What's your exponent? Please imagine that your exponent is 5. I mean 10, 5. I mean 100,000. Yes? 100,000. 560. Thank you very much. Great lady. It's correct. It's correct. Thank you very much. Here we are able to see. Numerator 21,000. Denominator 3,750,000. Yes? Crude death rate means 560 deaths per 100,000 population. Thank you very much. What's your name? Sare? Muaffaq Nouri Sare. Thank you very much. Any question? No problem. But I heard that a friend, one of our friends told 56. Why?
Use end as 4, not 5.
Oh,
Yeah.
yes.
It's correct.
It's correct. Thank you very much. It's correct if we wanna choose 4 for exponent. Yes.
Yeah.
But here, yes, we imagine that the exponent is 5. Yes, this is for you because we are near winter. Yes, and you can enjoy winter in Tehran. Yes, Tehran has a good winter. And another statistic. Here we have infant mortality rate. Again, we have a formula here. For example, infant mortality rate. Number of deaths of children less than 1 year of age in a year. Please pay attention, because when we are speaking about child death, we should determine it. We should say what we are going to say, what we are going to the period of time. For example, maybe some of people said that children as child as a guy or as a kid less than 2 years. Maybe some people say that child as a kid less than 1 month. But here, when we are speaking about infant mortality rate, we are emphasizing that the child age should be less than 1 year. Thank you very much. So, number of deaths of children less than 1 year of age in a year. It's our numerator, and for denominator we have number of live births in the same year. Number of live births in the same year. And mostly our coefficient is 1,000. Mostly. Yes. So here we say the ratio of infant deaths registered in a given year to the total number of live births registered in the same year, usually expressed as a rate per 1,000 live births. Is it clear?
Yes.
Yes. Thank you very much. And again, we have another statistic here. Maternal mortality rate. Maternal mortality rate. Here we have another formula. Yes? Please pay attention. Total number of female deaths due to complications of pregnancy, childbirth, or within 42 days of delivery from puerperal causes in an area during a given year for numerator, and for denominator we have total number of live births in the same area and year. So here multiply 1,000. Of course, in some other instances they consider 100,000 as a coefficient. So ideally the denominator should include all deliveries and abortion. So please attention, and please pay attention when we are speaking to maternal deaths. So we should explain, we should relate it to any cause of death that related to pregnancy, to puerperal duration, period. According to WHO,